By March 26, the US had the most number of COVID-19 infections in the world.
To put it bluntly, the US was unprepared for it. They held on to a very optimistic view that this was an Asian problem, that it wouldn't reach them.
In US, they have missed the golden opportunity to do a better job in February. And it's mainly incompetence.
According to a report in the New York Times, US President Donald Trump had already been warned by the intelligence community and health officials about an impending pandemic. But he had sought to play it down to help protect his economic gains.
You recall that, he was saying things like it was a hoax and that after that, things were under control.
That was one of the key pieces that said it. He was in the middle of an election, and in the middle of a US election is a bad time to have a pandemic because every political incentive he had was to have good news. The second was the entire narrative of the Trump administration has been focused on two things. One, keeping out foreigners and border control, and two, how great the economy is. Well, this pandemic is bad news on both fronts.
Michelle Gutierrez is a registered nurse in California. It was in mid-January when she read a few online stories about the outbreak in Wuhan. Much to her dismay, there was a total lack of response from the US Center for Disease Control and Prevention, or the CDC, to the outbreak in China.
It took so long for CDC to change their criteria back then, how to identify COVID suspects. All the way up to February 28th, they didn't change their CDC guidelines to identify everybody that traveled outside of the country who were having fever, shortness of breath, or cough. And the problem with that is then our isolation precautions and our infection control precautions did not kick in to wear the actual appropriate PPE, which left us then vulnerable.
For a country that prides itself on being a global leader in science, technology, and innovation, it was baffling to see how the US has been caught flat-footed, even in the midst of a tragedy that was unfolding in Asia and Europe.
The CDC failed in its efforts to deploy a test, and that is remarkable to me. I don't really know why that happened at the degree to which it did, but our failure to mobilize all the rest of the resources within the US healthcare system was because it was so decentralized and so privatized. There wasn't a way to move forward.
No matter how many millions of masks and PPE that these politicians and these agencies are saying that they're procuring, it's not getting to us in the front lines. It's locked up somewhere in a manager's office. We don't know where these supplies are. They're certainly not getting into our hands.
Many of the frontliners are suffering from psychological and mental health problems in their valiant efforts to save lives and keep the pandemic under control.
The nurses, by virtue of our role, we're always prepared. No matter where you send us, disaster relief or everyday care or somebody crashing in the sidewalk, we're always prepared. But it's a different matter when our employers are not prepared and our government is not prepared. And, we're going in there into the battlefield and the trenches every day without the appropriate protective equipment and the appropriate tools to not only protect us, but protect all of our patients that we serve on that day.
The US in its early response clearly focused on the political frame of keeping a foreign virus out. The president talked a lot about this being a Chinese virus, and so the focus was really on border measures and border closures and banning certain people from coming to the country.
The US detected the first COVID-19 patient on January 21st. 2 days later, President Trump imposed a ban upon arrival on all non-US citizens who had traveled to China. But it was already too late. With no adequate protection, testing facilities and social distancing measures in place, the virus began to spread like wildfire. Today, America has the highest number of COVID-19 infections and deaths. Yet, many Americans came out to oppose the lockdown measures due to the damage these restrictions have done to their livelihoods. They also called on the government to reopen the economy. That sentiment is also shared by Mr. Trump. Blue states with Democratic governors like New York are resisting any federal force to prematurely lift quarantine measures, while red states or Republican governors such as Texas and Michigan support the president's message. But experts believe opening the economy too soon may prove suicidal to the lives of the American people.
The mild cases are left in the community, and that's a problem because then the virus continues to spread. If things are not implemented carefully and aggressively, there's a chance that hundreds of thousands of people will die from COVID-19.
Now that we're seeing the beginning of testing ramping up, we're seeing that kind of capacity, the millions of tests starting to roll out. Had that happened starting in mid-January when we knew that there was the beginning of an outbreak, we would be in a very different place than we are right now.